MoCA, what does it mean, MoCA? MoCA means mechanical occlusion chemically assisted. On the market, there are two devices, but only one permits a rotational mechanical occlusion. MoCA combines two effects, so the mechanical action due to the rotation of the catheter, the rotation of the tip of the catheter, that allow a mechanical damage of the wall with the chemical action of the sclerosa. This method was born more than 10 years ago, but the first published data was in 2013. Later, in 2016, the first randomized clinical trial up to 2020, when appears the first result, the first data at 5 years of follow-up. At the beginning, the first study published demonstrated an excellent technical success, that it was very, very important for a new technique that arises on the market, but with a few number of patients and a very, very short follow-up. Later, the other paper presents a greater number of patients, but once again with a very short follow-up at maximum 6 months. Later in 2016, the first randomized clinical trials, and finally in 2017, the first published data from Netherlands, from the group of Netherlands, with the result at 3 years, with an excellent 88% of occlusion at 3 years, but only with 38 patients. Later appears a systematic review, a 3 randomized clinical trial, and finally in 2020, 2 papers with the result at 5 years. This trial, published in 2019, was important, in my opinion, because it highlighted the importance of the diameter. We have to consider the mean diameter when we use this technique. And they concluded that bigger is the diameter, the mean diameter of a vein that you treat, bigger probably is the recanalization. This other trial, the Maradona trial, show a better result after the treatment with radiofrequency compared to MoCA at 1 year, the same result at 2 years, but at 2 years there is not a statistical significance. At 2 years, they show a complete failures in 9 patients after radiofrequency, and 9 patients with MoCA and 7 patients with radiofrequency. The conclusion, they show that MoCA of gelsafenozine result in less postoperative pain. So the trial compares also the pain and not only the anatomic result, with a clinical success rate that were equal to those of radiofrequency and MoCA at 1 year and 2 year follow-up, but with more anatomic failure, especially partial recanalization. But I want to highlight some other points and other critical issues, in particular, once again, the diameter, because they include some patients with mean diameter of 12 millimeters, so very too big for this technique. We don't know how many patients with so big vein, but anyway, there are some patients with bigger vein. The other problem is the polydoconal. They use a polydoconal at 3% and not at 2 as the protocol, the standard protocol, but they use 2 ml of 3% of polydoconal. That is too low, up to in the first 15 centimeters. So it's better 3 millimeters probably and not 2 millimeters. The other problem is the polydoconal at 1.5% in the other part and not at 2%. So probably influence the result.